Thank you, everybody, for joining this new series of open online briefings. We're calling them 4SD open online briefings, and we're hoping that they will become increasingly popular with people who've tracked what we do in 4SD and also have engaged with us over time. I'd just like to give you a little bit more on that, but before I get into the formal stuff, just I want to say super happy new year to everybody. Really, really lovely to be with you and connected again. And I've really valued enormously the opportunity to meet with you on more than 100 occasions in these online briefings. So just to say that very straight as something that I think is hugely important. And I'd like to particularly give a shout out today to Chris Shipton, who's kindly come back from live illustration to join us. That's a wonderful thing. He sent me a lovely message over the break as he was dealing with his own COVID. So that's great. Chris, you look well, got rid of that stupid virus. I'd also like to give a special shout out to Marianne, who was here. And she's actually on vacation in New Zealand, and that means that it's about 2 or 3 in the morning for her. And it's a really immensely kind thing of you, Twee, to wake up or get up early in the morning. Thank you. Now, some people have noticed that I got this amazing, rather surprising gift from the King of England on the 1st of January 2023, and that's being knighted, a thing called the Knight Commander of St. Michael and St. George. It's an order of chivalry that is reserved really for people who spent their time working outside the UK. So when you look at people who get KCMG, you'll find that these are mostly people who've been ambassadors or worked internationally like me. And in The Anatomy of Britain, a writer called Anthony Sampson said the way to remember KCMG is from the following little expression: kindly call me God. And so KCMG, which really means Knight Commander of St. Michael and St. George, is often inside the Foreign Office referred to as this. And it's the list of people that are put forward for honours to the King via the Prime Minister from the Foreign Secretary. I was really pleased to see that Mo Ibrahim, for example, and a number of other really extraordinary people were also knighted in KCMG. So super gratitude to everybody for your thanks. And it's lovely that my sister Anne and my brother William are on this discussion, and they've both been amazing about this. So just to start with the introduction that Mahika and I have prepared, what we're doing now is the new series. They're called 4SD Foundation Open Online Briefings. Our little company 4SD over the New Year period has now morphed into being a public good foundation under Swiss law and based in Geneva. And so our 4SD Foundation Open Online Briefings are the new series of briefings that will look at global events and ongoing processes with a living systems lens. And this is how we at 4SD Foundation try to address complex issues. I want to give a shout out here to John Atkinson, who, don't know where he is on your screen. He's somewhat on the 3 down on the left on my screen. In our 4SD Foundation, where Florence Lasben is the executive director, John Atkinson is our systems leadership guru. And he actually brought to us the concept of living systems. That's systems that are made up of living creatures, and we're particularly interested in systems that are populated by humans. Now, the important thing about humans is they cannot function in a mechanical way. They can be machine-like, as people attempted to do on assembly lines some years ago in Industrial Revolution. But more and more, you realize that if you try to treat people as though they're parts of machines, it doesn't work. And that you need a different series of ways of thinking and working when you are dealing with living systems or systems made up of living creatures. And in particular, we believe that there are features to systems made up of humans that need very special attention and that cannot be approached through treating humans as though they are, as I say, parts of a machine, or even creatures in a hierarchy where those at the bottom will do what they're told to by those at the top. In fact, as we all know in practice, it just doesn't work like that. And so the living systems leadership approach that 4SD articulates and that John has been teaching us helps to really appreciate the specific characteristics of human-made systems. And within that, there's an incredible, important ability of human systems to contain innate knowledge and also to organize in a particular way, to deal with complexity, and also through symbiosis and at the same time disruption, to foster the emergence of new ways of doing things that really show very little connection to the past. It's that approach to thinking about living systems and living systems leadership that will be coursing through the briefings that we hold. And when John's here, we will explicitly ask John to comment using a living systems lens whenever he wants to, and to just come in with his perceptions. And there are people who've worked with John who tend to join these sessions, and we will be looking to them to also participate in the systems commentary. There are several of you, particularly including those, well, Chris Langdon certainly, but others who've worked with him, and Richard Longhurst's done the same, who've been doing systems work in your lives. And I very much hope that you will not hesitate to indicate if you wish to comment and to take the discussion further. Now, we'll explore through these briefings what we mean by living systems leadership and how living systems skills and capabilities play out in real time in the work we do in the 4SD Foundation. If we produce interesting papers, we'll tell you about them, but more importantly, if we're developing arguments and analyses for possible publication, we will want to share them with you, and we will invite you to be part of the process. Each session we will aim to function as follows. It'll begin with me providing a quick overview, as we've done before, but I really will stop after 20 minutes, and then I will invite others to come in. And increasingly, we will try to make sure that those of you who enjoy systems thinking and systems working and systems leadership will be particularly invited to join. We will stick with 4 p.m. on Friday. It's a little bit earlier than we used to do them. And we will record the meetings and we will share them on the 4SD YouTube channel and on our other social media platforms. But if at any point you say something you don't want it on, as some of you already know, we'll remove it, and we'll remove it without fuss. It may take a couple of days, and we'll remove it before it goes up onto any website. We had an issue with one colleague where we had to go back afterwards and remove something, but in general, we will make certain that it's done before it goes up. Now, if you want to comment on this, and indeed, if you ever want anything removed, do contact Mahika Acharya. That's Mahika at 4sd.info. And Mahika, who's on here, and you can see her, has just put that email address into the website, into the chat. I do want to talk a bit this time about COVID. I'd also like to talk about health systems and the general sense that we have that health systems are particularly stretched in many different settings, many different countries, many different continents. I'd like to talk about the global cost of living crisis and the recent analyses that we've been involved in, and that's about it. I have one or two other things up my sleeve, but I don't want to say I'll do things and then end up not doing them. I'll tell you also during these sessions what our plans are, where we are traveling, if we're traveling, or events that we're involved in, just in case that's relevant. At all times, we want to be receiving your comments and suggestions, and this is meant to be an interactive and responsive process. Now, a little bit on COVID-19. So the pandemic is still very much underway. It's still viewed as a public health emergency of international concern by WHO. And we've always said in these briefings that the virus is the problem and people are the solution. So in this pandemic, you've got to know where the virus is and what it's doing. And so it's got really difficult recently because the infrastructure for actually measuring who's got COVID and what happens to them is being quite rapidly dismantled around the world. And the systems for making certain that test results are properly pulled together is also being dismantled. So that means that any statistics that one sees about numbers of cases and numbers of deaths have to be interpreted with real care. The current statistics are telling us that the COVID situation globally is still quite active. We are still seeing of the order of 11,000 people dying with COVID a week. And so in the week 2 to 8 January, we had 11,000 COVID deaths reported. We know that's an underestimate because of the lack of testing. But it's quite important to still hold that figure, because when people say the pandemic's over, it doesn't make sense if you've got about 11,000 people dying with the virus each week. And so that high figure, and even though the testing is so incomplete, is a sign to me that this pandemic is still quite active. And the big issue, and one on which I've been doing quite a lot of talking about on the media and so on, is what's actually happening in China. So China has had a zero COVID policy until the end of last year. And that meant that China was using every possible instrument to try to keep the virus out. So that meant that people traveling to China had to go into quarantine, but it also meant that if COVID did crop up in a particular part of the country, that people were asked to stay at home. And this led to some quite widely reported discontent. And then the Chinese position changed. The Chinese authorities tell us they were going to change anyway. But the consequence has been that there's clearly an awful lot of COVID around because of the fact that there hadn't been much in the population and levels of immunity were low. And plus also immunization levels anyway with anti-COVID vaccine in China are relatively low compared with other places, particularly among older people. Now, we know from our other work that you need to immunize older people, you need to immunize people with diabetes, immunize people who are exposed, because they're the ones who are most likely to get COVID. But unfortunately, the older population groups in China have still got, in some places, 30 or 40% coverage with two doses and lower coverage with boosters. And that in turn means that there's a real likelihood that unless people are really lucky, that they could end up with quite high death rates. Now, this was what was suspected over the period end of December, beginning of January. And there was an awful lot of interest among people all over the world in the possibility, first of all, that there might be greatly increased levels of COVID disease incidence and greatly increased levels of COVID mortality in this giant country. And so there was a lot of looking around for evidence. People were using interpretations of satellite pictures to try to identify crowds around crematoria. And they were spending quite a lot of time, even in press conferences in WHO just after Christmas, saying we don't trust the Chinese figures. Well, I don't know what is happening. I do know that WHO, through quite careful work of being particularly circumspect not to produce speculative information on COVID mortality in China, I know that WHO was able to initiate quite detailed discussions with the Chinese Centers for Disease Control. And yes, there's probably more mortality than is being reported in the statistics coming out of Beijing, but there's certainly not widespread death of the kind that was being talked about in other countries. And you can tell throughout the last month that there's been an awful lot of geopolitics playing through, with folk wanting to be able to say that China scored an own goal through the zero COVID policies and has now got an awful lot of mortality. Well, that's not true. I think the reality is that there is certainly more death because there's more of the virus moving around. But I certainly have got no evidence that there is a very large amount of death in China as a result of COVID. Now, what is happening in China is that the existing variants of Omicron are moving around. There is not much transmission of a new variant of Omicron in China, but there is a new variant traveling around in much of the world that happens to be a recombination of two of the existing Omicron variants, and it's called XBB 1.5. Now, the difficulty about recombinations is they can end up being quite randomly nasty. But by and large, we're not seeing many unpleasant recombinants around in this particular situation. And although XBB 1.5 appears to be slightly more transmissible than other variants of Omicron, based on the currently available information, there's no suggestion that it causes more severe illness. There's a lot of people looking at that, and more assessments of its severity or clinical severity are being undertaken by the WHO. So more COVID surges happening, but as yet, no evidence of the emergence of a really concerning subvariant, though there is a recombinant subvariant called, as I say, XBB 1.5, about which more information is being requested. Bottom line, COVID's still here. COVID is still causing quite a lot of disease and disruption. It is important that if there are localized surges that build up again, that people do revert to the public health and safety measures that we know can be quite effective, and we should include mask wearing, physical distancing, use of ventilation in particular as the primary means. People have asked me, should we be going back to mask mandates? And I'm saying I'm really keen not to go back to mandates for anything on COVID, because I think it leads to a lot of distress and discomfort among quite large numbers of people. On the global crisis, I just want, on the health systems, one of the things that I'm trying to do is to encourage people not to use the term health systems have collapsed. It's a bit like another term that I hear where people say food systems are broken. No, I don't think it's quite like that. I don't think health systems do collapse in like a building collapses. No, what happens is aspects of health systems become stretched, extremely stretched, very stretched, or perhaps may for a period of time have to stop working. But that doesn't necessarily mean that it applies everywhere. It tends to be somewhat temporary, but it does lead to real difficulties if people are trying to use health systems when they're in this stretched state. I am, by and large, therefore, when asked, saying, yes, health systems everywhere are stretched. Why are they stretched? Because demands are always increasing as populations become older, as more and more treatments and procedures become available. And so the costs of healthcare go up, and that makes it very difficult indeed to constantly fuel with enough money to keep the system going. And at the same time, historically, health workers tend to have been paid rather low. There's been an expectation that there's a contract between health workers and society. I don't quite know what that basis of that contract is, that health workers will do their work at relatively low levels of payment, and that then there is also the question of how much actual real demand there is on healthcare. And right now, because of a coincidence of a number of different viral illnesses like flu, like respiratory syncytial virus, that we have got a lot of demand on health services, plus there's the pent-up demand because of the impact of COVID. So taken together, there's a lot of stress in health systems, and it's throughout Western Europe, it's throughout North America, it's throughout Latin America, it's throughout Africa, it's throughout Asia. Health systems everywhere are stretched, and there's a particular challenge under those circumstances. These historically underpaid workers are saying, are we really going to go on not only being underpaid, but because of inflation, are we going to accept the fact that the purchasing power of our salaries suddenly dropped by 20%? And in many cases, they're saying enough is enough. They're saying enough is enough in a number of countries, including France, where I live, and they're saying that also in Britain. And I think it's going to be quite a tricky period. I don't want to myself take a position on how governments and others should respond, because they will face great difficulties with squaring the need to increase funding for services like health, and the same applies to education and so on, when national treasuries are trying desperately to reduce public expenditure. You'll all have views on it. This is a big, big challenge at the moment. And this is a subset, number 3 point, of the wider cost of living crisis, which is affecting the whole world. 94 countries exposed, more than 50 countries in real difficulty because they're in debt to a very large degree and having difficulty with debt servicing. Possibly 5 or 6 countries, I don't know the exact figure, actually defaulting on debt service payments. 20 countries telling us that they've got severe food insecurity. 6 countries where there's so much severe food insecurity, they're referred to as having famine-like conditions. This is a massive global crisis, cost of living crisis with high levels of inflation. And then lastly, I want to just say that to complete, we will be seeking to try to understand how it's going to be possible for people to work together on issues around public health, issues around climate change, and issues around biodiversity. This is going to be the theme of the Prince Mahidol Award Conference, PMAC, in Bangkok, where I'm going to be present between about the 25th and 29th of January. And it's also a theme of a number of other groups that are working at the moment, particularly getting ready for the next climate COP in United Arab Emirates in November, and following up from the Montreal Kunming Biodiversity COP that took place at the end of last year. So I just wanted to say that this is now taking up time. I'd like to go straight to encourage comments from all of you. Maria van Kerkhove has joined. Maria and I have had a number of exchanges recently, but I did say to her that I am immensely grateful to her and her colleagues in WHO for letting me access all the technical information they have. And Maria, I've just been talking a little bit about some of the challenges that you face in trying to assess what's going on, but some of the consistent advice that you've been giving in the regular meetings. Over to you for your view on things, and thank you for joining.
Hi, David. Hi, everyone. Happy New Year. Hope all of you had a moment of rest and relaxation over the holiday period, and I'm wishing you all a happy, healthy, safe 2023. I don't know, David, I don't have too long to stay on the line, but I'm happy to just some general thoughts. I mean, I think we're entering this 4th year of this pandemic, which really kind of shocks me to say out loud. And we're in a bit of a messy period. The world wants to move on. No one wants to talk about this right now. But this virus is around. The virus is here to stay. It's circulating incredibly intensely. We're in a much better place because, population level immunity is increased around the world, but it's not even. And we have key demographics, key people in every single country who have not been fully vaccinated. I think it's not just about getting vaccinated, but when was your last dose? And unfortunately, between 10 and 14,000 people are dying every week. Doesn't make the news anymore, but these are deaths that can be prevented. So the virus is taking advantage of this and it's evolving, and you will continue to hear the next variant, the next subvariant, the next subvariant, and that's going to continue. So our job is to be able to monitor this at a global level, assess each one of these, and so that we can take into account what needs to be changed, what needs to be modified, do our diagnostics work, do our therapeutics work, do our vaccines work, and advise the world. And we're trying to transition the response in the sense of dealing with COVID, managing COVID in the context of all of these other issues that the world is facing. And we can do this. But the fiscal space, to deal with COVID is shrinking. And a lot of what was put in place for COVID cannot be maintained, but it also can't be dropped. So we need financing. We need the workforce I came in as you were talking about healthcare systems and workforce. And many healthcare systems around the world are just struggling, and they're buckling under the weight of COVID and flu and RSV, but also from staff shortages and from incredibly difficult working conditions over many years. And so there's a lot of factors that are there, which you've outlined, but we're in this for the long haul in terms of WHO and our partners to be able to continue to work, make sure that we have good surveillance, we have good sequencing, we have good clinical care, that we plan and deal and finance and manage long COVID. Some are waking up to this and realizing what needs to be done, but many have not. So we've been trying to raise, alarm bells around the need for financing to be able to study this, and to plan for this and to have better understanding, better clinical management. But this is going to take some time. So on the one hand, I'm very hopeful that we can end this public health emergency this year. There's no reason we couldn't. I thought we could end it last year. But on the other, I'm really concerned about the complacency. I'm worried about the fatigue. I'm worried about the mental health aspects and we haven't really begun to even mourn the loss. So lots of sort of juxtaposition of feeling, but there's a lot of amazing people who are out there who are working every single day that are working with us. There's a lot of focus and attention on China right now, as there should be, and we're working with them to get more information out. But the threat remains everywhere. And we have to get these vaccination levels up, particularly among the at-risk populations, in the context of huge amounts of misinformation, disinformation, politicization. So there's a lot more work to do. We're committed. We're optimistic. We're tired, as I'm sure every single one of you are. But it's our job. And we love what we do to help everyone we can everywhere. But the thing that gets me the most are these deaths. There's so many people that are dying from this every day that we know about, and so many more that we don't know about. And I don't think we're really dealing with that now, nor are we dealing with the medium to long-term effects of long COVID. So lots to do, David. It's always a pleasure to talk to you into this group, and I can answer a few questions, but then I will have to hop off.
So Maria, on the long COVID thinking and action, as you move around the world now and meet up with some of the people you've had to deal with on Zoom for so many months, are you finding that the long COVID challenge is pretty ubiquitous, or does it tend to be concentrated in certain countries, either because that's where people are looking out for it, or because of some susceptibility to whatever it is that causes long COVID in those areas?
We haven't seen any differences by country. This is not something that is affecting only certain parts of the world. It will impact every country. It is impacting every country. Certainly we're trying to get a better understanding of who is at risk for long COVID and why, and how long some of these effects will last. There are studies coming out every day, but it's patchy. It's not a consistent, systematic way that it's being studied. A lot of the work comes from high income countries. It's good to have something from somewhere, but we really want to see these cohort studies established in different countries and different, in high income and low income around the world. And it's not clear. I mean, I'm not going to sugarcoat this and try to give answers where I don't have answers, but it's not completely clear. I do know that there are dedicated people around the world that are focused on this. They need the financing and the time to be able to study this. That's what I'm worried about right now, is the financing. And we just don't see it. So we need to all be advocating for funds for this, because we don't know for how long we will need, but long COVID needs to be managed within healthcare systems. I do see in some countries, they're managing it as a standalone with some really innovative ways of doing that, but it does need to be incorporated into the system, because once the financing goes, that standalone facility will shut down. And we don't want to see that happen.
That's what I've noticed as well. Dedicated testing, dedicated vaccine sites, they're being closed as quick as possible. Absolutely. If anybody else has any particular question they'd like to ask Maria, because she's got to go off very shortly, now's the time to do so. My own question to you, while I'm seeing whether anybody else comes in, is what can people like us do to help you the most? Is it working with our own communities? Is it lobbying governments? Is it working in our professional organizations and universities? Is there anything in particular? My own feeling was you need help from all of us to stress that the pandemic is not finished. And although that sounds a trivial thing, it's a hugely important thing. Over to you for any specific you'd like us to do.
No, it's all of the above. Every single one of those examples will be helpful. I think being able to talk about COVID in the context of everything else, that's what I find is that people say, well, we can't deal with COVID because there are all of these other things, that we put aside over the last few years. It's not dealing with COVID at the expense of other issues. That's not what we're saying. What we're trying to say is, how do we deal with COVID in the context of everything, making sure that systems that have been built, that research that has been funded, that is ongoing, continues, but is calibrated as we go forward. Certainly, if you can do, I know many of you treat patients. I know many of you are involved in research. Obviously, that needs to continue. Share your experiences and also share the positive experiences. At the moment, there's a lot of finger pointing and blame, and there's plenty of that to go around. But I think this fourth year, we also need to learn more from each other and what went well. Like, a lot of people have figured out innovative ways to kind of get through this. And I think of this a lot in some of the surveillance systems and countries that are, adapting what they've been doing in this transition. This transition period is going to be messy, and it's going to take a few years. It's not just going to flip a switch and be over, and then COVID is just something we manage like we manage flu. It's going to be messy for a while because the virus hasn't settled down. It's still relatively new. There's a lot of questions that need to be answered. So more research, trying to answer these basic questions and having to re-ask them again, because each new variant makes us say, well, what we knew previously, is it still the same? It just needs to continue. So advocating for this and keep doing what you're doing. Let me know what I can do to help you do what you do. That's more the question.
Well, you mentioned misinformation, and I know this is a real problem for everybody in WHO. Just about everything you put up, every activity you do, you get this constant, horrible, smelly, nasty rudeness that is so offensive. Even the most thick-skinned person can't help but be flinching internally, at least when they get it. Now, we found that one of us was pointing out that even some health professionals unwittingly seem to be contributing to misinformation. Somebody wrote in the chat that she'd picked up that clinicians were saying that they'd not seen people with COVID in intensive care for a year, therefore the pandemic must be over. We've had others making similar remarks from inside the profession. Do you think it's necessary and desirable that we have a real blitz on health professionals to try to get them a bit more on message?
Well, I think there's a huge amount of misinformation and disinformation that's out there, and it feels like it's getting worse at the moment. And it's a very hard narrative to counter. If you're seeing this type of information in your own little bubble, it's incredibly persuasive. And it's pitched in a way and it's shared in a way that is meant to convince you. I think there is a lot that can be done to counter this. I think working with healthcare professionals around the world to help, to answer questions. They have questions too. We're not saying that things should not be challenged. And I think having, health workers around the world are trusted everywhere on the planet. And so having them be equipped with accurate, up-to-date information so that they can work with their patients and listen to their patients' fears, listen to their patients' question, and answer them as best as they can. Certainly that is absolutely worthwhile. I think nobody wants to hear that the pandemic is not over, but unfortunately the pandemic is not over. So it is my responsibility to give some tough love and to give the reality check. And I'm okay to do that as long as I also say there's a lot of things that we can do. And that's why I'm optimistic. We have all the tools we need. We have them all. We're just not utilizing them everywhere. And that's what is really frustrating.
Maria, on behalf of all of us, you are just an amazing professional, and working with you is a sheer delight. Thank you again.
Thank you, David.
The reason why I'm doing it a bit like this is I know you have to run off, and I wanted just to make the point, obviously, if you stay with us, that's great. But just on behalf of all of us, big thanks.
Thank you so much, David. A pleasure to see all of you.
Let's go to Chris Shipton. Chris Shipton from Live Illustration has been keeping in touch with us since this team stopped, and we've got a Chris Shipton special. You remember his amazing COVIDs. Here they are. Chris, over to you.
Oh, hello. It's great to be back. I heard you on the radio, getting out there and sort of delivering the message in your very diplomatic style, which I think is always good to hear, especially with all that disinformation circulating. I had COVID over Christmas. Everyone I know has had COVID over Christmas. So I think my observation was, where was my booster? I'm under 50, so I didn't get one. And it's amazing, like there's still a sort of pervading fear. The people I know had it, one person really struck me. They said, their family went into complete panic when they all had COVID because they had 3 relatives go to hospital and not come back. And it's still there in the background, but I think we have, normalized it or forgotten about it because it's too hard to think about. But anyway, that's just my very quick 2 pennies worth. But also, I couldn't resist the temptation to draw you as a knight.
I've just seen okay, fine. Chris, that's brilliant. Thank you very much indeed. Thank you. And there the knight is stabbing the coronavirus. Beautiful. It's wonderful to have you with us, Chris. Your sense of humor transcends everything. And the fact that you've chosen to come back, despite the fact that Live Illustration is a bit stretched, is also a beautiful thing. And if ever we can do anything for you and your colleagues, please do let us know. You know that we'll always welcome you here in whatever capacity you choose to come. Thank you, Chris.
It's lovely to be back and hear your voice and see everyone again. So
thanks. I'd like to move to John Atkinson and introduce to you how I hope we will work with John. And then I just want to spend a minute or two just reflecting on the discussions about the global risks report from the World Economic Forum. And then I've got, I was going to invite Henk, Bekedam, Rebecca Kanter, Spijkers, if they want to speak. Those were names that I picked up. So John, please.
Thanks, David. I'd like to pick up on some things in the chat. I will touch on the WEF risk report, if only to say in systems terms, it's worth looking a little bit further down the report. What you often get on these things is big lists of things, and lists by their nature are linear. There are these 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 things this year, and look how they change to next year. If you scroll down the WEF report, you'll find they also do a map, which says how they think these things connect together. Now, do they connect like that? Who knows? But the point is that they're all interconnected. You can't think of COVID without thinking of it in the context of wider health systems. And as you know, Maria making that point really clearly, but also as both Richard and Chris saying, and I don't know, David, if you want to call some of these people maybe as well, if there's time, you can't think of health systems without thinking about food, the diet we eat, whether we're producing chronic health conditions or whether it makes us susceptible to infections or whatever else. So all of these things connect together, and therefore I think one of the things that we've been looking at particularly is things not in isolation. How do we connect in our messaging COVID to the social situations in the countries in which we're getting the chance to speak? I'd also like to pick up just briefly on something Sarah put in the chat, one about integrated care systems. That's a particular thing in England at the moment. But what it's saying is if you're thinking about how do you make a health system more resilient, you need to look at it in the context of the place. You need to look at it in terms of quite a wide range of the determinants of health. Someone called Marmot particularly listed those, and we've spoken about those in the past. But rather than think about how do we make our hospital system work, how do we make the whole care system work? And the thing that I particularly picked up on, Sarah, is what you were talking about with regards to emergence. Now, we've been using the word emergence quite a bit, and it means something to us quite specifically. It's that moment where a human system or any living system transcends to a different state. And it does that because you get a big buildup of energy, a critical instability, and then new networks are formed. And as leaders, we can encourage that to take place. We can work specifically on building energy towards particular things through the stories that we tell, through the way that we just show up, whether we dampen down enthusiasm or bring it up. We can do that by bringing in dissonance. We did that particularly with the dialogues on food systems. We were saying, we want everybody in the room. We want people who disagree. We want people who don't even think dialogues are a good thing to all be in there talking. But then you've got to create this means of rapid amplification. And when you do that, living systems can transform. Any human system, any biological system can transform really quite dramatically quickly once those conditions are in place. So that's been behind a lot of one of the things that we've been working on and talking about. And I thought it might be helpful just to draw some of those threads together, David.
John, thank you. Can I ask you to repeat once again the elements inside systems that lead or can lead to the emergence of a new state? Rapid amplification, dissonance, but just give us the headings, because I think we will come back to those again and again.
So it's what we've been working with, David. It's about energy. Is there sufficient energy stored in the system for something to change? If one or two people really want the world to be different and most of the rest of the world doesn't care, those people can throw energy at it and not get anywhere. How do you tap into the combined collective energy? So that's one thing we're looking for. And as leaders, we can do quite a lot to encourage that, to find that, to allow that to be expressed. But the next thing is, if we've all got energy for the same thing, that may be great if it's the thing that needs to happen, but most likely it's therefore not a change. It's what's already going on now. So it might improve something, but it doesn't move us to another state. And the thing that changes it is when you bring dissonance, disruption, disturbance, difference into the room. It's why diversity is so critically important in every setting. So energy is the first, disturbance or dissonance is the second, and then there needs to be the means for rapid amplification. So one of the things we constantly do is look to create environments where we connect different people together who wouldn't normally be talking. This is one of them, but the food systems dialogues, for example, brought together all sorts of different networks of different people, different stakeholders, different sectors, people working at different levels, people in different countries, different continents, different parts of the world. So how you never quite know what the amplification thing is that's going to work, but what you do know is unless you keep connecting and connecting and connecting, you're not creating the potential for something really exciting to emerge.
And sometimes when we're talking with John, we bring in one other term to describe what is happening when we're interacting with systems. We talk about holding the tension that exists, because when you are working with a system and there is a lot of energy bubbling up and down, and there is dissonance and disturbance, and things are being amplified, it gets quite tense, quite intense. And those of us who are in some way or other facilitating the process of working with a system, John referred to the dialogues that we did quite a lot of, those of us doing it have to be really quite relaxed about handling quite massive tensions that exist within groups of people. And instead of asking everybody to harmonize and reach an agreement, we actually sometimes say, you won't agree, but it's being able to coexist with the disagreement that is absolutely critical at this point in time. I don't know, John, whether you would wish to make any comment on my effort as an amateur to be offering a commentary on the system's issues, but I wanted to add that.
Well, you may see yourself as an amateur, as a commentator, but certainly not an amateur in terms of experience of doing it. And I think this is the key. If we want that difference, that dissonance, that disturbance in there, if we don't have enough, nothing moves. If we have too much, it's a fight. Everybody falls out, and it may be counterproductive. So we're constantly feeling into how far can we push this? How far can we take this? And we get a sense of that by constantly talking, connecting to people, feeling their discomfort, how much is okay, how much is not. And if you're not really intimately connected to what's going on, it's all too easy to blunder in and say, yeah, we need some difference, we need some disturbance, and you make everything fracture, and you could send back things years in the process. So it's a very delicate process, and it's a relational process, and it runs therefore as a way of working quite contrary to some of the ways that people would traditionally talk about getting things done.
So blundering disturbances are quite difficult to cope with, and we've all witnessed that when an individual goes into a group and doesn't meet people where they really are, doesn't feel into the rhythm of their interactions and so on, can easily say, oh, well, I've come to really shake you up, and you get that kind of, it's almost like a disc jockey putting on the wrong music at a dance night, and it feels very weird, and it messes things up. Thank you, John, for that. John, I hope you'll come in. We've still got a few minutes left. I hope you'll come in any time and let us know. Meanwhile, let's go to Henk Bekedam, please.
Good afternoon, everybody. Good evening, etc. And happy New Year, and happy to see all of you. I was just asked to say a little bit about the bird flu from what's happening. Let me also introduce it from. I was very proud to be in 2021. I became a chair of a zoonose expert group. The Dutch government, they looked at the risk analysis, and I was working with the Ministry of Health and Ministry of Agriculture. And I was very fortunate to have a lot of good experts. In the Netherlands, we have a lot of animals as well on a small space of land. And one of the things that we started also looking at was the zoonoses, which is again also linked very much to the COVID part. And just one or two things that I only would like to raise. I can talk about a report far much longer, but also like to link up with John and with the systems and the like. Now, on the bird flu, what's happening with H5N1, that's not new. H5N1 has been around for quite some time. But what has been new now, normally in Europe, H5N1 infections were seasonal. They were normally starting, and you could almost look at the watch when it was starting, October, November. And by the time that the sun was coming up and spring and summer would start, it would disappear. The last two seasons, the H5N1 has been continuing circulating in Europe. And geographically, it's also moved to the Americas now. And these are new things, and these are a bit of concern. Also because we don't know if this is circulating continually, not only in wild animals, but also in domestic animals, that they will get in touch with other viruses. And there was one part of our report, what we also did, is looking, for instance, at pigs, where the H1N1 was circulating, especially in those big farms, where the H1 kept on circulating, because by the time that the new ones were moving on to go to another place, new other pigs were born again, etc. So these are some of the concerns that we came up with. But going back to, because on this one I can talk for quite some time, David, but I would like to link it with John was saying. From one of the things that we came up with is we need to look at One Health. We need to look at the health of animals, the health of humans, but the health also of environment. This is a system issue which we need to put together, because these are important for food, the food concerns, the health of people, etc. And that's one thing which I also hope that perhaps we can one time have a discussion about One Health and looking at some of these aspects, and we were combining systems and people, and also look at the sustainability aspect. Something very concrete, because otherwise you think that some of the work that we've done is a lot of talk. No, we had very concrete things. We said in 2021, we should not have poultry farms near to a water. The Dutch strategy will now trying now to ensure that no new poultry farms will be next to water. Now, this is not something for the Netherlands. We have also said we need to be internationally thinking about these things. So I think I would leave it like this, David, but happy to talk more about another occasion.
But I'm led to understand that the somewhat overcrowded situation you have with an awful lot of animals, particularly four-legged animals, but also the birds, rather close to humans and very high water tables, has created an almost unsustainable situation, which is threatening or has threatened the well-being of the current government. Is that right, or am I just have I fantasized?
No, I think that part is not true. I think our discussion in the Netherlands is where the sensitivities are lying around the nitrogen discussion. Yeah. And that part has, because the government hasn't been dealing with it for the last 20 years, we have a huge issue. Yeah. This part is more on the infectious part, and that one actually we can learn a lot from even what's happening in the Netherlands, because we have become quite good in preventing the contact between. But still more, I think it's a European issue. It's a global issue, the whole issue about H5N1. So that's a broad discussion, David.
Thank you very much indeed. So bird flu really is a problem. Some of you are probably finding that there are less eggs on your shelves than you would normally expect to get. Also, the shooting of game birds in some countries has been curtailed, etc., etc., etc. Thank you, Henk, for reminding us about the enormity of this issue. I'd like to go to Rebecca Kanter for any comment, please.
Hi, thank you. Happy New Year, everyone. It's just a small comment that actually Jane Bekedam passed on to me, because she's currently at a birthday party. But if y'all remember Jane, she's also part of this group, and we actually had the opportunity to meet in person in December at the International Congress of Nutrition in Japan. So it was just, she just wanted me to share that experience, that finally, after so many years on Zoom, we were able to meet in person, and it was just amazing being able to see people from this group in person. And we just felt like immediately connected, and we actually both sort of recognized each other in our masks, like in passing on the first day before we could organize actually meeting up. So that was also fun. Rebecca, so that's basically the main thing I wanted to share.
The screen is covered in smiles. That is a lovely story. Thank you very much. Anything else?
Just so the ICU admissions thing, that still frustrates me, and I think that it was helpful to hear from you all in the group that that's happening globally. Brilliant. And I have to say, as I think Maria usually gives very critically thoughtful answers, but I thought her answer to how to work with health professionals about that was not as forthcoming as she usually is. So that's just one other thing. And then another thing is I'm actually contemplating getting my 6th vaccine dose, since I have not had a vaccine in a year, and I'm about to go on summer holiday. However, Chile is hoarding the bivalent vaccines for priority populations right now. So if I go get a 6th dose, it would just be a monovalent dose. So I'm kind of debating what to do. I could go get a 6th bivalent dose in the United States, but then it won't be accepted here in Chile when I come back. So it's just one of these COVID games conundrums that keeps happening.
On
That's
that
it.
one, I'd be very happy to follow up with you bilaterally. It's something I couldn't do off the cuff now, but a lot of people are explaining these very difficult situations of needing to get extra vaccines to be able to travel. So they end up with rather large numbers of vaccinations, and it's not good. So let's be ready to have a bilateral exchange. I'd like to, if I may, move to Ad Spijkers. Hello, Ad.
Good evening, colleagues, and David, kudos for all what you did last year and you will do in the future. Very briefly, Henk had raised One Health. I think it would be good if your team also reflect on the possibility to have a bit more reflection on that. The human health, the animal health, and the plant health is an issue I think this group could really dig in and give us some recommendations. John, you came up last year with the 3 C's: conflict, COVID, and climate. And also, David, you mentioned again the cost of living. And really, when you listen to the IMF this week, David, there is a big problem in front of us that 700 or 800 million to 1 billion people will face serious difficulties on their food. And that is a good thing of this platform. You start with COVID, it will be COVID, but as John mentioned also, it has so much related to other things. And really, I would like that your team, and I think Henk and others will also contribute to make this link a bit also to the cost of living and the food issue in general. We speak about Netherlands, of course, a small spot on the global scene. Our concentration was the last weeks a bit on Africa still, David. And I gave you an English translation of a column which was published in December here in Wageningen. I would very much like if you look at the possibilities to give us a helping hand and put it out on your website, the English version. It gives a little bit of an inspiration also how we can move from this crisis to opportunities. That is with a number of colleagues in Wageningen to be discussed the last days. And really I want to make a bit of a bridge also what we know here with my group in Holland, what you do in Geneva and elsewhere in the world. But still, let's in 2023 try to give some extra emphasis and attention to Africa, because
Thank you.
I believe still there the big problems.
It's highly relevant what you've written in your paper. Whether the actual nomenclature is appropriate or not, I don't know, but very much I'm putting my head into that. Thank you. I'd like to go to Marianne Haslegrave, and then after Marianne Haslegrave, Chris Langdon, then William Nabarro if he wants, then John Atkinson, then we stop. So let's do that. Marianne, please.
Thank you, David, and congratulations. What I have to say is I'm concerned from what's being said, because going back to what you were saying about the direction that things appear to be going with the conference you've mentioned, we are moving away from other areas and it's to my mind denigrating the whole concept of the SDGs, because they're all interlinked, and what's missing or is underplayed is our social aspects like education. The impact of COVID on education will have years and years of difficulties for young people. Also, when you look at the gender issues, they're not there in the direction in which you're going. And I really do think that we have to have a broader approach, and that we should be focusing towards the SDG summit in September. And while the environmental aspects of climate change are extremely important, we have to think of what the actual lives of poor people and how they're surviving. And I was very glad to hear about the idea of the focus on Africa. That is where our future is. That is where population growth is going to be going up. And that is where there's an enormous need. Thank you, David.
Thank you very much indeed, and a big applause from at least one person on the screen. Absolutely right, and so important. And Chris Langton, please.
Just since we're right at the end, just to comment, I absolutely agree that the social justice aspect is absolutely critical. Very much listening to what you're saying, David, and also John. I'm doing parallel work. I'm about to have a call with a major university on what this interconnected looks like, and just what we can do together, and issues of information, disinformation are part of it. So I'd just like to put down a marker for a further conversation when we have more time on those subjects, and how there's parallel work going on. It sounds a bit like what John was talking about on radical collaboration, what he was talking about radical dissonance, and how you work together despite differences. So I think, as they say on the best soap operas, to be continued.
Thank you very much indeed. I think the one thing that John and I and others of us who've been trying to get comfortable with the interconnection have really had to focus on is that we often find it is the same people who tend to suffer as a result of breakdowns in different systems, whether it's health or energy or education or food. It's poorer people. And these poorer people tend to be clustered together in places. And what you really need to understand to get on top of this is the power relations that impact on poorer people, or impact where poorer people to gather together in places. And it's then when you've got the power relations as well as an understanding of the characteristics of the people and the place that things start to make sense. People, place, power. And I don't say that we've got any easy way of factoring that together, and we're trying super hard to be able to take the way we're thinking into lots of different locations. William Nabarro, please.
Thank you, David. Agreeing with you, with Marianne, with Chris, with John, because this is about creating firstly a conceptual, but ultimately a practical framework within which progress across the consequences of the wide range of problems can be addressed. It does go back to the SDGs. It does ultimately go back to making available sufficient resource on a global basis to enable problems to be addressed concertedly and collectively rather than individually. And I think one just got to keep open that panoramic way of thinking about this series of issues.
Thank you very much. We will come back to that again and again, because what's become clear to us is that when efforts are made to try to finance activities linked to one or more SDG, that almost always means providing finance that goes across different ministries or different sectors or different departments or different offices, so that you are able to have that, as you say, panoramic approach. Jolly hard to do that in practice, because there are so many forces that suck the money into existing channels. Anything that anybody has got for subsequent sessions on how to finance interconnected approaches to sustainable development, super interested to hear from you. It's super relevant, I believe, to what William just said. I'd like to go to John, please.
Quickly from me, David. One thing that strikes me listening to how the conversation is developed is wherever you start, and probably all of us start in slightly different places and from slightly different viewpoints, you have to follow where, if you're going to work this way, it means following wherever it leads, and going across those boundaries that you described really is often incredibly difficult, and you bump into a lot of resistance in doing it. And too often at that point, we step back and say, okay, well, we'll just stay in our space because we're making some difference there, and surely that's a good thing. But if we're really going to get the panoramic sort of view that William's describing, we have to find ways to transcend existing boundaries. The interconnectedness, as I think someone put in, is key, but not necessarily easy. So really looking forward to hearing perhaps stories of where people have done that, things that they've done that worked, but wherever you start, you need to follow where it takes you and not say, well, we're not going there because that's a trade issue and we can't deal with trade. Sometimes you've got to get yourself into a difficult space.
Thank you, John. Annie Feltham has been a remarkably effective connector and disruptor, I would like to say. I mean, that's how I've seen you, Annie. Would you like to give us your motto, and then I'll ask Mahika to close us?
Yeah, it just made me laugh the first time I heard this, because a lot of what you're saying is what we've been doing in development for years, or trying to, not always succeeding, obviously, and actually turning around and looking at your own environment and seeing how you can do it there is quite interesting. And so my motto, which I got actually from a nurse, a senior nurse in our local NHS, was proceed until apprehended. And that's what we're doing locally in terms of breaking down the boundaries, so that people, in order to address any particular problem, we can't just work in our own pockets. It's a slow process. We've been at it for over a decade, but I think the points are getting through. So thank you. Congratulations, David, and Happy New Year, everybody.
Thank you very much. And Nigel Lloyd had just a little rider to that. Nigel. That was meant to be a slick changeover. Thank you very much. Mahika, please.
Hi, thanks. I really like proceed until apprehended. That's going to be my new favorite motto. Let me just spotlight Chris. Yeah, I just want to tell you, Chris, how happy I am, and actually how happy the 4SD team is to welcome you back for this session, and how grateful we are to Live Illustration for playing such an important and integral role in 4SD's open online COVID briefings that ended last month, in communicating our messages regarding the pandemic. It's amazing. Thank you so much. And thank you everyone for joining. It's really nice to see all of you again after the break. I just want to reiterate that these meetings are recorded and they'll be shared on 4SD's YouTube and social media accounts. So if there's anything in this meeting that you want to be edited or removed, as David already mentioned, don't hesitate to email me, maybe this weekend or early next week. And for updates on the next meeting, which will be monthly, you can follow us on Twitter or LinkedIn, or subscribe to our newsletter by the link that I will share in the chat now.
Thank you very much indeed. And the newsletter is the primary means for us to communicate with you, because dates are not easy to hold in place right at the moment. And that's just because there's an awful lot whizzing around right now. Thank you very much for coming. Happy New Year. Lovely, lovely exchanges. Very, very great friendship and solidarity between us. It's super good to get recognized. I think that applies to all of us who've been working on international health issues. And please feel part of it if you want to. And have a lovely rest of January, early February. Bye-bye. Thank you.